Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
While all children encounter difficulties in paying attention, listening, following directions, remaining still, or waiting their turn at times, those with ADHD experience these struggles more intensely and frequently. ADHD, also known as Attention Deficit Hyperactivity Disorder, is a condition where these challenges surpass occasional fidgeting or daydreaming. This condition deeply influences various facets of a child's existence, including academic achievement, social interactions, and emotional health. Our discussion seeks to illuminate the intricate nature of ADHD in children, examining its diverse expressions, its repercussions, and significantly the approaches and support networks essential for empowering these children to flourish in a society that frequently overlooks their distinctive requirements. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media. To help us decipher the complexities of ADHD in children, we have with us renowned clinical psychologist and counselor, Dr. Manisha Gaur. Dr. Manisha Gaur is the Chief Clinical Psychologist and Counselor at the Gaur Mental Health Clinic, The Addiction and Heart to Heart Counseling Center, Civil Lines, Ajmer. She is dedicated to providing compassionate care and evidence based therapies. Her remarkable work focuses on enhancing the psychological management of the mother baby bond and fostering healthier relationships between mothers and their infants for a brighter future. So, Dr. Manisha, THIP Media welcomes you, ma'am.
Thank you. Hello, Soumya. How are you?
I'm fine, ma'am. How are you?
I'm good too. Thank you.
Thank you so much for joining us today, ma'am. And we all understand now that ADHD, it can be a very challenging condition for both, children and their families. So I just wanted to, start this discussion by asking that what exactly is ADHD?
So, Soumya, this topic is really close to my heart because this is usually untouched topic, and
Yeah,
parents doesn't know also. Like just not parents, people don't know what ADHD is.
right,
So, ADHD, it's basically it's a disorder which is generally seen in children. It's
right.
a neurological, generate. It's basically because of the neurons.
Okay,
It's a psychiatric childhood disorder
okay,
where the
right,
neurons are also involved, right?
okay,
And
right,
it is genetic, right?
oh, okay.
So, yeah.
Yeah, and you just mentioned that, it is genetic and it's usually common amongst
Hmm.
children. So, and it's very likely that they are more prone to developing this
Yeah.
condition because of the genetic factor. So, what are the other potential causes of ADHD other than genetics, and how do they contribute to its development?
Basically, 1 in 7 child. So, if you look at the data, we don't have much of Indian studies, but when we look at the data, we'll find many children in the school, in the classes, or at home also. This is usually diagnosed after the age of like 3 to 4 years,
Okay,
not before that, but the symptoms can be seen earlier also. But primary cause is the genetic. If any of the sibling is suffering from attention deficiency hyperactive disorder, or any of the parents are suffering from the genetic disorder, the this attention deficiency hyperactive disorder, it is genetically being transformed. Then
okay,
ADHD can also happen due to some of the traumatic situations during the pregnancy. If the mother has gone through some kind of difficulty, maybe some kind of seizure, some kind of epileptic fit during the child was in the womb, or some kind of incident or accident happened during the time of pregnancy or during the delivery. So the prenatal, postnatal factors are also uh, the serious factors are also affected, that
right,
affects the brain, the child's brain.
Okay.
That can be the cause of ADHD. Sometimes epilepsy also becomes the cause of ADHD. The comorbidity can be
Okay.
ADHD because of epilepsy also.
Okay, right. And you've just mentioned that usually the symptoms they exhibit at the age of, let's say, 3 to 4 years. So
Huh.
could you shed some light on the early signs and symptoms of ADHD that parents, should look out for in their children?
So, when we talk about ADHD, usually children, uh, एक छोटी सी बात होती है, हर घर में अक्सर ऐसा पाया जाता है कि बच्चे नटखट होते हैं.
Ji.
Children are naughty, and
Right,
ADHD children, so parents don't have that acceptance of children being extra naughty or notorious. So
right,
ADHD children, the symptoms, you can easily see that they cannot sit stable. They cannot sit at
okay,
one place. It is difficult for them to sit comfortably, even at the situations where they are expected to sit. Say, like
right,
if they're going out with their parents, everybody, usually children would sit quietly and calmly, but the ADHD children would uh, go and look at each and every corner of the house, even would open the fridge and see what all other things kept in the fridge at the stranger's
right,
place.
right, right,
So this is one of the symptoms that they cannot sit comfortably. Frigidity is present in them. They are
right,
always moving their hands or feet, and they're jumping, doing something or the other. Difficult for them to focus. If anything, if there is a doorbell ringing or the phone ringing, they're the first one to focus on that. They would run and they would see, if people elders are talking, they are the one who would interfere. Nahi, pehle
right.
meri hi baat suno.
That's
They don't have that much of patience that they can
right,
stand and wait in the queue, or they can finish, they can permit others to finish what they are speaking, or they can wait for the conversation to get over. Or if there are other children in the family also, and if the things are being brought in and distributed in the class as well,
right,
so they would be the first one ki nahi, pehle mujhe chahiye. I
right,
want it first, you know.
right.
And that is what happens during the sports also.
Okay.
बॉल है,
Right.
टर्न आ रहा है सबका लेने का, but the
Right.
ADHD would want to catch each and everybody's ball and would want to take each and everybody's turn.
Right.
So
Right.
it is not that the child is doing it intentionally, but
Yeah.
unintentionally, because of the hyperactive behavior, this tends
Right.
to happen.
Right.
So these
And
are
I'm
few of the symptoms that can be seen from the childhood, like 3 to 4 years.
okay.
Nail biting and all these fidgetities can
Oh,
easily be seen.
right. And I'm sure that this must be having some, impacts on their social life and, their emotional well-being. So, how does this ADHD affect the social and emotional well-being of children and adolescents?
A lot, a lot. Children
Right.
come up, they reach us at very late age.
Right.
What happens, I'll just share an incident with you. Uh, a parent, a child who came to me, they changed 6 to 7 schools, and the
Okay.
parent came and blamed each and every school. ये स्कूल अच्छा नहीं था, हमने बच्चे का स्कूल बदलवा दिया. Every
Ji.
school is not good because they are not
Right.
able to handle the child well. But they could
Right.
not accept the problem in the child. And the school
Yes.
could not identify that the child has difficulty sitting at one place, has difficulty focusing.
Right.
So here the thing is that the ADHD child, because is not able to focus well or is not able to sit at one place, is not able to concentrate, keeps getting scolding,
Yes. Yes.
right? Scolding at
Right.
home, scolding
Yes.
in school, does not
Yes.
have a good peer group because
Right.
cannot adjust well with the friends also. Because
Yes.
of the impatience, they want to take each and every turn by themselves. So,
Yes.
kuch bhi galti hogi, it is all the child whose ADHD will be blamed for everything, even if the child is
Right.
not at fault. So that
Right.
impacts child's emotional well-being a lot. They get into a lot of anxiety. They get into, their shell that I'm not being accepted. I don't have friends, and they do not even realize what their fault is because in their sense they are too much righteous. They are doing something right. They did not do anything wrong. They do not even realize that they are taking somebody else's turn, and
Yes.
sometimes they get violent also, that why are they misbehaving. They would
Yes.
push back somebody, they would hurt anybody because they're insulting, and they become then they're bullied a lot also in that school then by
Oh,
other friends. So they don't have a friend circle. And for all those reasons, they lose their confidence. And because they lose their self-confidence, that impacts their mental well-being. And that affects their anxiety, levels of anxiety. And of course, in the later periods, sometimes they get depressed as well. And many antisocial behavior, if
Yes.
not well treated well on time.
Absolutely. And I think this antisocial behavior would definitely have an impact on their academic performance, especially in
Um,
terms of study and taking exams.
yes. All it's just not the antisocial behavior, because the child wants acceptance in society.
Right,
They want peer group. So
right.
if they're not getting that peer group, if they're not getting that peer group in a positive way, they would do for that acceptance in the peer group. They would do all the things whatever is being asked by them to do, even
Yes,
if it
right,
is wrong. They would not go
right,
or think about it because they want acceptance. You just have this cigarette, you will
hmm
come in the group. He would go for
right,
that cigarette when the
right,
child gets into teenage. You just
right.
go and do this or give this letter. A case came to me where a child dropped in a letter in a girl's bag written by
Oh,
somebody else because he
okay.
wanted acceptance in that group,
hmm Right,
right? So
right.
he or she doesn't think of that consequence,
Yes, yes,
that this will happen, but because that acceptance. And then academically, yes, because they are not able to concentrate, because they are not able to sit and focus, for focus and for their attention. Our short term memories for like 30 seconds. So if we taken something that retains in the mind for 30 seconds, but we need to revise that to take it in a
right,
long memory. But because they are not able to focus, attention ADHD बच्चे जो होते हैं, what happens with them is that their mind is constantly running, that ये भी करना है, then I have to do this. Parents will often see that they are not stable with one activity at a time. वो एक
right.
गेम खेलेंगे, उसको भी खेलेंगे, they'll switch on to the another game, they would leave
hmm
that game, that task incomplete, and they would go to the third one. They develop boredom very early, and because of that boredom they are not able to complete their things well. They're not able to complete their class tasks very well. Most of their homework copies or classwork books and notebooks are incomplete. They're not able to copy their work well because
hmm
of the attention. So by the time they are able to sustain their attention, the work on the board has already been rubbed.
Right,
So because of that, they are not able to retain and take the things in their long-term memory, and
right,
so that retention is not there, registration is not there, so that recall is also not there, which affects their academics.
right. And so, are there any alternative or complementary therapies that have shown promise in managing these ADHD symptoms?
Yes, we do have. So
hmm
there is no 100% permanent treatment for ADHD symptom, but nowadays we have, if we talk about the psychiatric treatment and if we talk about the psychological treatment, we have both the things. There are good medical treatment also, good drugs which have come out, which can
Okay.
help in managing ADHD treatment also, which starts after the age of like 4 or 5. It depends on the
Right,
severity of the attention deficiency hyperactive disorder of the child. And there are psychotherapeutic treatment also,
right.
where it is done on the basis of on the child for
Right.
the behavior modification. So cognitive behavior therapy works very well with the child. So behavior therapies work well with the child, and then parent management techniques are very important. So it is just
Okay.
not the child who needs to be trained or who needs to be managed. It is also
Right.
the parents who need to be managed. Their
Right.
parenting style with the ADHD children has to be different. It is
Right.
not going to be the same with a normal child, and
Right.
also with the school people, because
Okay.
half of the day of the child is being spent in the school.
Right.
Till the child is in the school. How the child is managed in the school is also
Right.
to be taken care of. So the therapy plan takes care of all these 3 to 4 things with the child. The child's
Okay.
behavior modification, then parent management technique, and the school management, the teacher management technique also.
So you've just mentioned about a couple of cases you've come across. So are there any common misconceptions about ADHD? I mean, and how can parents and educators work together to dispel these myths and promote an accurate understanding of this condition?
Right. So, सबसे बड़ा misconception तो यही होता है ना. The biggest misconception is that ADHD is something that the child is very naughty and is related to some learning disorder, is some mental illness, but it is not a learning disorder. It is
Hmm.
not that every hyperactive. Another misconception is that hyperactive children, that ADHD means the child is always jumping. It is not necessary that the ADHD child has has both the factors. ADHD can be attention deficiency also, and ADHD can be hyperactive also.
Okay,
We It is not necessary that an ADHD child will have hyperactivity plus attention deficiency, both the things together. They can
right.
have either of them also. So these
Okay,
are the misconceptions basically. Then the thing is that ADHD will be recovered by itself, and by the time the child reaches adulthood will be completely fine. It is not so. It sometimes, in some of the cases, it reduces by the time the child reaches at the teenage, but it very much depends on the severity of ADHD, which is
mhm,
being diagnosed, which is only noticed after the diagnosis, after the test we do at the early
mhm,
age. After that we
okay,
can decide that whether it will be managed, and after the therapeutic treatments given, if well on time,
right.
then it's being managed. So adult ADHD is also present. So
Okay,
these are the things which are generally the myths. um, and there was
associated.
another question along with the myths which you asked me.
It was about that, being how can parents and teachers, works together to dispel these
Yes.
myths?
So for that, parents and teachers, they need to understand, one thing, they need to consult. They must consult the specialist. So seeing a psychologist and a psychiatrist again is not a stigma. आपका बच्चा पागल नहीं है. ये problem है which can also be handled by seeing a psychologist and a psychiatrist. Second thing, uh, techniques which I told, where some of the things which teachers must take care, that if they have a ADHD child in the class, they must make them sit right in front of their eyes,
Okay,
so that they can focus more, and the child gets more of attention by the teacher. When the child gets attention by the teacher, child feels comfortable and more confident that I'm being given attention by the teacher. Then ADHD child have that energy level. If they have
okay,
more of their energy level, if their energy is being consumed in a proper and positive manner, so
right,
maybe teachers can give them some of the task of keep these notebooks in the staff room. So
right,
if they get to move in between in the class with permission, they would not
right.
disturb the class without permission. Go
Okay,
and rub the board.
mhm,
So, with permission, they are moving their body. So, they will
right,
not disturb other students without permission. And these
okay,
are some of the ways how they can take care. Rather than making them sit near the window so that they are just looking out of the window from the class, they sit right in front of the teacher. And if the teachers take care about all these things, similarly at home, if parents take care of them rather than shouting at them all the time, ये किया कि नहीं, होमवर्क करने क्यों नहीं बैठते हो, कपड़े क्यों नहीं चेंज किए अभी तक, कपड़े ढंग से क्यों नहीं रखे, सॉक्स और शूज जगह पे क्यों नहीं रखे. That is what parents keep yelling at. So
yes,
rather than yelling at them, instructing them once daily, at the same time looking into their eyes gently, would give them a reminder every
yes,
day at the same time, will fix that in their mind,
right,
and
right,
will not give them a negative feedback of that scolding, that I'm being scolded all the time.
yes,
Right? So
right,
these are certain things which even the teachers and the parents together can work on. Rather than scolding them, काम पूरा क्यों नहीं किया? Parents can help them out. नहीं किया कोई बात नहीं. They can request the teacher, if his work is not complete, please send somebody's notebook or send me the picture of the work so that I can make him do at home. Another big myth is that only boys suffer from ADHD. But the
ah,
fact is that even girls suffer from ADHD.
right, Okay. So now this is my favorite part. Uh, I'm summarizing everything. It's been a beautiful discussion so far. So I want you to provide us with a comprehensive to-do list
Hmm.
for parents of a child identified with ADHD.
Hmm. So if you have, so all the dear parents, if your child is suffering from ADHD, your child is a special child, do not scold your child. Rather, make a timetable for your child, a comfortable timetable for your child where you specifically give time, you can give time to your child. So usually, mothers, if they're homemakers, they have a lot to do at home, but they come and say me that I'm with the child whole day long, but you're not with the child, you're with your assignments, with your work also. So give a specific time, quality time to your child where you can sit and work with your child and give that time so that your child understands the things. Number two, if the mother is a working mother, then also she needs to make a timetable, a routine chart where the child's work is being distributed. So after coming back from school, there has to be a chart where the child's tasks are being written down, that this is a time for your lunch, this is the time for your drawing, this is a time for your homework, this is a time for your sports. And the child must get a reward, that is a star, for the work done. All right. That is a visual reminder for the child that yes, I have to do these things at that time, and you will not have to scold. Then I need to say to all the fathers also that child is not only the responsibility of mother, is
Right.
also the responsibility of fathers. So both the parents are responsible for the child. So if your child is suffering from attention deficiency hyperactive disorder, you need to give specific time to your child where you need to have plenty of energy games with your child. That can be, you can play badminton, or I want all of you to play outdoor games with your child, just not sitting together and watching TV or video games or nothing that. I would want you to avoid uh, video games or television if your child is suffering from ADHD. So I think if you go on with all these things, this is a brief list. There's a lot to do with ADHD child. We can plan
Right.
it out, but this is a brief
Right.
list what you can do with your ADHD children.
And I'm
With
sure
love,
this
everything is
list
possible.
Absolutely, but I'm sure that this list would depend from child to child. Probably,
Yes, yes,
you've given
yes.
us some very beautiful points where parents can actually spend in some quality time with their kids and, help them out, release that extra hyperactiveness and just get along with that disciplined life that we expect them to have. So, thank you very much. I'm really
Thank
appreciating
you.
your presence today with us today, ma'am. Thank you so much.
Thank you. Thank you so
And
much.
I'm hoping that this enlightening information shared will be valuable to many families out
I hope
there.
so too.
And for more such informative videos, please subscribe to our channel and press the bell icon. And please do listen to Dr. Manisha's wonderful advice. Thank you so much for joining us today, ma'am. Thank you once again.